in today. The first one is John, that I think most of you know from a couple days ago. He's the one that came in, the 14-year-old boy who came in with testicular pain on and off for the past month. He's new to sexual activity. I treated him presumptively for gonorrhea, and the lab results came back and he does have gonorrhea. My name is Catherine Bluen. I'm a pediatric nurse practitioner here at the school-based health center. Primarily responsible for triaging, evaluating, diagnosing, and treating students within the school. So I'd like you to speak with him, Sierra, and hopefully reinforce abstinence and ensure that he has been abstinent since we treated him. And I know he saw you,
Sean,
so
both
right?
Sierra and I spoke with him briefly.
Okay.
He's not abstinent currently by any means. He has a girlfriend and they're having unprotected sex, which would be fine under normal circumstances, but since he has gonorrhea, that's a problem for reinfection. So good thing he's coming back. He's coming back today?
Yeah, he's scheduled to come back
he's
today.
Coming back for treatment today. We did a letter in his class once we found out the results, so he's just telling him to come back. So he's coming back for treatment. Oh no, he already got treatment.
I treated him.
So he's just coming back to talk about the results.
I treated him because his symptoms were significant enough.
Okay.
But I told him to come back in 2 days to review the lab results and kind of check in with us since he was so angry. I told him to be abstinent for, until the lab results came back, just to be sure. We'll see.
We'll see.
Hello, my name's Sean and I'm the social worker here at the school-based health center. Every morning we meet to have a huddle where we all, the provider and myself and the nurse and the medical assistant all get together to review some of the patients who are coming in that day, especially the more complicated patients, and it's my role to discuss any of the relevant mental health information.
And did Sierra tell you about the homicidal thoughts?
She mentioned them briefly, but he seemed pretty calm when I was speaking with him, so I didn't really get the full story.
Sierra, I was glad referred him to me because he was having thoughts of killing someone. I mean, the situation that he was in was pretty dramatic. His girlfriend he reported that she was raped by another teenager who gave the girlfriend gonorrhea, who gave him gonorrhea. That's how he's traced back this gonorrhea, and that could very well be accurate. So here he is talking to me saying that he wants to kill this guy. So of course she said that to Sierra first, so that set off a red flag. I met with him, and we did an assessment, talked through like the actual logistics of does he really want to kill this person. He's not actually going to kill him. He didn't actually have a plan to kill him. He didn't have the means to kill him, which was a relief. But he was clearly really angry, so I invited him to come back to continue like working on those emotions and like processing that stuff.
Good. So if he comes in, the other thing we should do is test for syphilis. So he didn't want that the other day, so if we could all kind of encourage him, and then we'll send him to you, Rima, for that. Hopefully, if he agrees, and get that sent out as well.
And we talked a lot about condom use last time he was here, because he wasn't doing that, and this was his first partner, and so did like a condom demonstration. He did it himself. So I think hopefully since we last saw him, he's been listening to your advice, but also if he's having sex using condoms.
Okay. So who he should see first? Sierra once he arrives, or?
Yeah, I guess it depends on if I'm with a patient or not. If I'm open, maybe just prep him and get him ready, and then if I'm with a patient, he could see Sierra first to review the lab results, and then if he's not been abstinent, he'll need the treatment again, and then maybe final Sean would be probably best.
Yeah, great.
As long as that works.
Okay, so that's the plan.
All right. And then the other one, gentleman that's coming in, I don't think you've met him. 20-year-old James Doe. So he came in sometime last week, can't quite remember the date, complaining of right shoulder pain from an injury 2 months prior.
Oh, wow.
He was trying to like shoulder open his bedroom door that was locked while intoxicated.
Was he in the bedroom or outside of the bedroom?
Yeah, he was outside of the bedroom trying to get in. I wasn't quite sure if it was into his apartment or just into his locked bedroom.
Sure.
He heard a pop snap.
Yeah.
His family was home though, and they got worried that he was going to hurt himself because he was intoxicated and out of control. So they called the police. They transported him to the ER.
So parents called the cops on him.
Yeah.
Does he live with? Oh, who does he live with at home?
Yeah, he lives with mom, brother,
He's-
sister, and
He's
a
not a
niece.
minor though, so he's 20.
Oh,
Yeah, he's
okay,
20.
sure.
Mhm.
Lives with mom and then siblings.
And
his
a
wife.
niece.
And
an
he's the
infant niece.
breadwinner.
He's the breadwinner. Yeah, he's got a couple stressors.
Yeah.
He went to the hospital, and they just observed him while he sobered up. He did not tell them he hurt his shoulder.
Mm-hmm.
So when he came in and saw me, he has an obvious deformity. I think it's likely fractured. He's undocumented, and like Sierra said, he's the main breadwinner.
I'm Sierra Turrigier, and I'm the health educator and the access coordinator at the health center. And at the clinic, I provide individual health education for students on reproductive health, nutrition, and all of that. So in the Huddle, I collaborate with the providers about any kind of health education needs for the patients, and I also do health insurance enrollment for uninsured or underinsured patients. So he's uninsured. He's enrolled in emergency Medicaid because he doesn't qualify for any, because he's undocumented and he's an adult. He doesn't qualify for any of the health insurance programs. And this emergency Medicaid doesn't cover this kind of injury, especially because it's been a while. It's been 2 months. So we set him up with a public hospital that's close to him that does reimbursement programs. So because he has emergency Medicaid, it kind of proves his status, his immigration status. So he's gonna have to get the bill back, but then he can apply to have most of it covered and just pay a copay after the X-ray. So he has an appointment in about a week and a half.
That's great.
Yeah.
That's great.
Well, we
He has an X-ray appointment.
He has a
X-ray and ortho appointment.
Yeah.
So the plan is that they'll do the X-ray there. He'll see the ortho team, and then whether he needs just physical therapy or bracing or surgery, we'll find out.
So is this someone who you're thinking making referral to see me?
He should definitely see you. I mean,
Sure.
he was intoxicated, out of control.
Yeah.
He has a history of blackouts.
Mm-hmm.
But the other thing, like the big thing, is he's a 20-year-old high school senior, and he's working 2 jobs
Right.
to support his 2 siblings, his infant niece, and his mom.
Mm-hmm.
And depending on the result of this hospital appointment, whether or not he can maintain this work schedule.
Yeah.
He's,
Yeah.
He's a very pleasant, open,
That's great.
hardworking guy, but I think he needs some help.
Yeah, I mean, it seems like it would be time to step back and examine the dynamics of the family and how, can he go on like this? And it sounds like the answer may be no, and sort of figure out what else can he do moving forward. I mean, of course, all the services I do are what's the opposite of mandatory? Optional. Yeah. so he doesn't have to be engaged in care with me. I'm guessing that this is maybe the kind of person who's hard to engage. He's like the breadwinner. He wants to be in charge of everything. He didn't tell the hospital that anything was wrong, but something's shifting already because he's here, and he told you that something was wrong. Opens up to Sierra, so it's like we're meeting him where there's a change already happening. So hopefully I can be part of that change and continue making.
And I think part of the hospital is very practical because if they did do an X-ray there, he wouldn't have been able to pay for it. So I think that he kind of understood that here the services are something that he can handle. So
Yeah.
he's very eager to go to the orthopedic appointment. He really wants to get help with the injury. So
Right,
yeah.
something I think could be unfortunate. I would imagine they may say, you broke your shoulder, you can't work anymore.
I know.
And I wonder what that would do to him and to his family.
Yeah.
But he's part of a community program with assistance, so
Yeah.
maybe if he, if he has to take some time off work, maybe they could help him or help his mom get employment. I don't know. We'll have to. That's if you can explore kind of that.
Yeah, I'd love to.
And he's very close to the social worker at his school, so maybe you guys can coordinate as well. Yeah.
That's great to know. Yeah, that'd be a good way to hand off the care that way. Great. All right, so we have a lot of things to do moving forward with him.
Okay. Great. So if you see them, if they're supposed to come, but if there's a long wait in the waiting room or anything like that, just make sure they stay and tell them we know they're coming and we really want to see them. Don't let them kind of duck out the door if we can help it.
My name is Rima. I'm a medical assistant. So upon the arrival, all the patients who've been registered seeing me, getting just a quick vitals, chief complaints, doing a quick medical history screening, and we doing a point of care if patient needs to be, if it's applied for that particular patient. Then we making sure the patient is seeing a social worker if it's their first visit, or a health educator, and of course the provider for any needs. Is he due for any point of care that I need to do ahead of time?
No, he has a history of sexual activity over a year ago and recent testing, and that was all negative. So if that we could double check that, but I don't anticipate any point of care testing this time. Okay, cool.
Great.
All right. So that's it.